Uh, Good afternoon. Today we're going to talk about birth injuries. I'm your host, I'm your presenter for today, Mr.Mwanza. So, in definition, we can define birth injuries using two definitions. The first definition that we can use is we can define birth injuries as any injury that is suffered by a neonate during parturition, such as a fracture of a bone, stabilization of a joint, injury to the nerves, or intercranial hemorrhage. When you talk about parturition, what you're trying to talk about simply, this is a period that occurs from delivery of the placenta into the delivery of the baby. We can also define birth injuries as an impairment of the infant's body function or structure due to adverse influence that occur at birth. We know that during birth, during the mechanism of labor, there are three stages that are there. There's the first stage, the second stage, and to the last stage. The parturition, this is where the third stage now comes in. Okay. So in second stage of labor, this is where the most common we find a lot of instances of prolonged second stage of labor. We nicely understand all this when we start looking at the risk factors or the predisposing factors of birth injuries. Okay, so what are the risk factors? So the commonest risk factors that will lead to birth injuries in neonates is, number one, we talk about macrosomal babies. When you talk about macrosomal babies, what we're talking about is these are big babies. And most of these big babies, they come from diabetic mothers. When we start doing obstetrics and gynecology, or OBS, to being specific, when we look at diabetes in pregnancy, we'll nicely understand how this will contribute to babies being macrosomic. So when we talk about macrosomal babies, we're talking about big babies. So these babies, that higher risk or that higher chance of having injuries during birth. The other risk factors that we talk about prematurity or low birth weight. When you look at prematurity, you know that these are infants who are not fully grown, and anything that they are not able to fight or to face any challenges. So you find sometimes during the process of labor, there are high chances of being bruised. Another risk factor that is there for birth injuries, we'll look at malposition of the fetus. So the most common when we talk about malposition here, the most common one is breech presentation. So we know that the normal presentation where there are no any complications during labor is what? It's cephalic presentation. So in breech presentation, this predisposes babies to have birth injuries. We'll continue. We should know that there are different types of injuries. There are a lot of types of injuries. But in this tutorial, we're only going to consider 4 types of injuries, which are the most common birth injuries that occur in our hospital setting. The first one that we'll look at capillohematoma, caput saccadenum. We'll look at fractures. Also, we'll look at the peripheral nerve injuries. So let us look at these now in details one by one. Let us start with caput saccadenum. Okay. So when you talk about caput saccadenum, this is like a collagenous fluid collection above the periosteum. Okay. The presentation of the caput saccadenum is that it will present with a soft tissue swelling with a papular ecchymosis over the presenting portion of the scalp. It may extend across the midline and across the suture lines. We know that on the frontal part of the baby, there are what we call as sutures, whereby sometimes, depending in cases like cephalopelvic disproportion, we may find that these babies where the molding happens from, that's why the sutures are. So when you talk about papular ecchymosis, basically this is just the fluid accumulation that has formed. And the management of ecchymosis, what you can do sometimes, you can, it's not, sometimes they will go in on their own, or they'll subside, the swelling subsides on its own. But what we can also do for this is we can be doing the coat compression with the eyes. So the picture that is here, that's a presentation of how the caput sacchadenum looks like. Okay, so in most cases where you would find the caput sacchadenum is in cases where there is the use of vacuum extraction or forceps delivery, or we can say through where there is assisted delivery. This is the in common cases, or also where you may find that there's prolonged labor. So when there's prolonged labor, you know that when engagement there and the descent is happening, the baby has engaged here in awaiting to be expelled or awaiting for the third stage of labor to do what it to occur. So if it's prolonged, there is a high risk of this fluid now accumulating as a result, forming what? A caput. Okay, so how will these babies present when they're born? So these babies, the way they'll present when they're born, they'll have a swelling with a fluid, a papular ecchymosis of fluid that is there. Also, these babies sometimes will present with the bruising due to prolonged, it may be due to prolonged labor or due to the use of the vacuum extractor. So the advantage is that the caput sacchadenum that is formed, in few days of life, it subsides on its own. Okay, but there are rare cases where you may find that this fluid is excess. There is a high chance that this baby may go into shock, and if this baby is going to shock, the kind of shock that they can go in is what is called as hemorrhagic shock. And what you do to manage this shock, what you do is that you can do blood transfusion. The picture there nicely illustrates the layers of the skull, where you can see there's a dura mater there, there's a scalp. Okay, so until all the layers of the skin, until where the cephalohematoma may form, until the caput sacchadenum may form. We need to differentiate between the caput sacchadenum and the cephalohematoma. What is the management of the caput sacchadenum? Caput sacchadenum, there is no specific management that is needed, but only in a high instances where maybe there is hyperbilirubinemia. You know that what hyperbilirubinemia, this is the presence of bilirubin in blood. So if there's hyperbilirubinemia, what you do is it's simple. We put this baby on phototherapy. In cases where there is shock, you manage this baby by doing a blood transfusion. Let us look at another type of injury that is there. We'll look at cephalohematoma. Okay, so cephalohematoma, this is an effusion of blood under the periosteum that covers the skull bone. Remember when we talked about caput sacchadenum, we said it is celogenous fluid, the fluid collection that is there that forms. But in cephalohematoma now, what you're talking about is the blood collection that has formed under the periosteum. Okay? Mostly, how do cephalohematomas happen? They come as a result of friction between the fetal scalp and the maternal pelvis. So as a result of this friction that is there, you find that sometimes there will be a rupture of the blood vessel. If there's a rupture of this blood vessel, there's a high chance of this blood now doing what? Forming a hematoma. So the picture there nicely illustrates how the cephalohematoma looks like. If you look at this picture and another picture of the caput sacchadenum, you can nicely differentiate on how they look like. Okay, so cephalomatomas also these, they are common in CPD, okay, which is cephalopelvic disproportion. Okay, also here the most risk factors that you may find that it's also associated with forceps delivery, which you may happen extraction during the tearing of the periosteum from the bone, forceps splitting. So find that during forceps delivery, as you're trying to focus, there's a mechanism where you pull down and pull the baby up. So in that process, you find that there's tearing of the periosteum, okay, from the bone, and the result of this tearing of the periosteum, there'll be bleeding, and this bleeding will bring about the cephalohematoma. Okay, so if there is excess of blood loss in this hematoma that has been formed, there is a high chance that this baby may become anemic, or this baby may go into hypotension. What are the characteristics of cephalohematoma? Okay, so this cephalohematoma that is formed, when you press it, it does not, it's circumscribed, which means it does not fit, like it doesn't go in and stays inside, compared to the caput sacchadenum, which circumscribed. Because there, remember that in caput sacchadenum, what is there is the fluid accumulation. But in here now, more of it that is formed is formed by blood. Okay, so the other characteristic of cephalohematoma that is there is that it's not present at birth. So this baby will be delivered nicely with the, when you examine the baby, we do the examination of the newborn, the baby will be looking just fine with no any complication that are seen. But 12 hours post-birth, this is when you may identify the presence of the cephalohematoma. Okay, so the advantage of this hematoma that forms also is that it never crosses the suture line. So which means it's where the same part, the same areas where the caput sarcodenum forms. They're almost in the same areas where you find that this also the cephalohematoma. So the picture that is there, you can now see the difference between the caput sarcodenum and the cephalohematoma. You've seen that on the periosteum there, the caput sarcodenum, it forms above the periosteum. Okay? And in cephalohematoma now, because of the injury of the periosteum now, the blood vessels in between the skull bone and the periosteum. So you can actually differentiate between the caput sarcodenum and the cephalohematoma that is there. Clinical features. So what are the clinical features? The clinical features that are there is that there is usually swelling over the parietal or the occipital bone. Okay? So if under these babies when they're born, you will notice a swelling on the occipital bone or on the parietal. Okay? So the advantage that I said also is that these are limited to the surface of the cranial bones. They will never go as far to reach the sutures of the skull. Okay. On physical examination or diagnosis, when you say about the diagnosis, you can combine the diagnosis with the investigations that you're going to do. So when you do a physical examination, you find that there's a swelling that is there. And in cephalohematoma, it's non-pitting. Okay. Also, when you do a scar radiography, you can see the hematoma there. Another investigation for cephalohematoma that you can do is you can do cranial cavitated tomography. We can do hyperbilirubinemia. And if you find there's a presence of hyperbilirubinemia test there, what we do is that we introduce phototherapy to this baby. So in case there is prolonged stay of the cephalohematoma, we can do an aspiration of this mass. So we can do the culture from there in cases if we are trying to suspect an infection that has okay. Let us look at another breath injury that is there, which is intracranial hemorrhage. Okay, so we define intracranial hemorrhage as bleeding in the brain, okay, which is caused by the rupture of the blood vessels within the skull. We know that this skull has blood vessels, and if there is rupture of these blood vessels will start they will start bleeding from there. Okay, so and intracranial hemorrhage is very common in prematurely formed babies, because you know that in the process of labor